You are sitting in a plastic chair inside a Hagwon cram school at 11 p.m. on a Tuesday. Your back hurts, your eyes burn. The fluorescent light above you has been flickering for 3 hours, but no one complains because no one looks up. Around you, 40 other students are bent over the same math problem set. You are 17 years old. You have not eaten dinner. You will not sleep before 2 a.m. And none of this is unusual, because in South Korea, this is what it costs to become a doctor. The exam that decides your entire life is called the Sunung. 8 hours, 1 day, 1 score. That score determines which university accepts you, which career opens, which version of your future is allowed to exist. To get into any medical school in the country, you need to outperform 97% of every student who sits the test. To get into a top one like Seoul National, you need to be in the top 0.8%, not of medical applicants, of everyone. The country pauses for this exam. Flights are rescheduled, construction stops, traffic slows to a crawl, police escort students who are running late. For 9 hours, an entire nation holds its breath so teenagers can fill in bubbles on a sheet of paper. You fill in yours, then you wait, and that wait feels longer than anything the operating room will ever teach you. You get in. That is the first door. It does not feel like victory. It feels like the starting line just moved further away. Medical school in Korea is 6 years. The first 2 are called pre-med, which sounds gentle until you realize it means organic chemistry, anatomy lectures that start at 7 a.m., and an unspoken rule that sleep is a luxury you have not earned yet. By year 3, the real volume hits. The material that German medical students spread across 2 full years is compressed into a single year here. You memorize, you test, you memorize again. The phrase students use for this period translates roughly to the year that breaks you. Some students leave, most do not because they love it, but because quitting means the last 10 years of studying were for nothing, and in Korea, that math does not work. By year 5, you are rotating through hospitals, surgery, internal medicine, pediatrics, psychiatry. Each rotation is short. Each one shows you a different world, but one rotation changes everything. You walk into the plastic surgery ward at a university hospital and watch a surgeon rebuild a man's jaw after a car accident. Bone cut, repositioned, plated, wired. The man's face, which looked broken an hour ago, now looks human again. The surgeon does not celebrate. He pulls off his gloves, writes a note, and moves to the next case. You stand there a second too long. A resident notices and smiles. That is how it starts. Not with passion, with a pause you cannot explain. You graduate, you pass the Korean medical licensing exam, and then you enter the machine. 1 year of internship. You rotate again. Every department, every shift. The hours are not regulated the way civilian jobs are. Interns can legally work 88 hours a week. That number is a ceiling in theory. In practice, it is a floor. You eat in hallways. You sleep in a narrow on-call room that smells like instant coffee and recycled air. You learn to fall asleep in under 2 minutes because that is all the time you get. One night, an emergency comes in. A burn victim, 3rd degree. You hold skin back while a senior surgeon debrides the tissue. Your hands are steady, but your stomach is not. You do not vomit. You do not leave. You stand there and hold. That is the internship. Not learning what you can do, learning what you can stand. You choose plastic surgery. In Korea, only a handful of residency slots open each year. The competition is the top 1% of the top 1%. You are selected. 4 years of residency begin. During those 4 years, you must document at least 240 inpatient cases, 2,000 outpatient cases, and 170 essential surgical procedures. Those are the minimums. Most residents exceed them because the patient volume in Korean hospitals is unlike anywhere else in the world. A Korean plastic surgery resident in training will see 3 to 5 times the caseload of an American counterpart at the same stage. That is not a boast. That is the system. Korea produces surgeons the way factories produce precision parts: volume, repetition, correction, repeat. Your first year of residency, you do not operate. You watch, you hold retractors, you close wounds after the attending has finished the real work. You write charts until your handwriting stops looking like language. Your second year, they let you assist. Double eyelid surgery, the most common cosmetic procedure in the country. You make your first incision on a live patient under supervision. Your hand is steady, but slow. The attending watches without expression. Too deep, he says. You adjust. He says nothing else. That is the compliment. By year 3, you are handling cases, rhinoplasty, blepharoplasty, scar revisions. You start to see the difference between a surgeon who cuts and a surgeon who sculpts. A good nose job is not about making every nose look the same. It's about making one nose look like it was always supposed to be there. Your attending tells you something you will never forget. A face is not a canvas, it's a conversation. You don't add to it, you listen to it. That sentence changes the way your hands move for the rest of your career. Fourth year, you prepare for the board exam. 2 professional examinations, written and practical, administered by the Korean Society of Plastic and Reconstructive Surgeons. You must also present at a conference and publish at least 1 academic paper. The exam is not a formality. People fail. If you fail, 4 years of residency mean nothing. You study in the same way you studied for the Sunung, except now the stakes are not which school you attend. The stakes are whether you become a surgeon at all. You pass. They hand you a certificate. You are now a board-certified plastic surgeon. You are approximately 30 years old. You have spent more than a decade preparing for this moment. It does not feel like an ending. It feels like a door you still have to walk through. Now comes the choice that defines your life. Path 1, stay at the university hospital, become a fellow, spend 2 more years training under a professor, publish papers, teach residents, aim for a professorship. The pay is modest, the prestige is enormous, the hours are brutal. You operate on reconstructive cases, cleft palates, burn victims, trauma patients, cancer survivors who need faces rebuilt after tumors are removed. This is the work that the public never sees. No before and after photos, no Instagram reels, just a mother watching her child smile symmetrically for the first time. You go home late, you eat alone, you tell yourself it matters. It does, but the residents who left for Gangnam are already making 5 times your salary. Path 2, Gangnam. The word itself sounds like money. 1 district in Seoul, a few square kilometers, over 500 plastic surgery clinics packed into streets so dense that their neon signs stack on top of each other like playing cards. This is where the money lives. This is where patients fly in from China, Japan, Vietnam, the Middle East, Europe. This is where a single rhinoplasty costs $3,000 to $4,000, and a surgeon can perform 4 or 5 in a single day. You take a job at an established clinic. You are the junior surgeon. You do not choose your patients. They are assigned to you. You work under a senior surgeon whose name is on the building. Your job is to be fast, clean, and invisible. Some days you perform the same procedure 6 times in a row. Double eyelid, double eyelid, double eyelid, rhinoplasty, rhinoplasty, double eyelid. By the 4th surgery, your body moves from memory. Your hands know where the crease should fall before your brain finishes calculating. This is what volume does. It turns thinking into reflex. And reflex in surgery is the difference between 4 hours and 90 minutes. But the volume comes with a shadow. The clinic is busy. The senior surgeon's face is on the billboard outside. Patients book consultations with him. They trust him. They go under anesthesia expecting his hands. But the clinic has 15 procedures scheduled today. One man can't be in 5 operating rooms at once. So sometimes the man whose face is on the billboard is not the man holding the scalpel. They call it ghost surgery. The patient doesn't know. The chart may not say. The cameras, if they exist, may not be checked. A junior surgeon, sometimes a general practitioner, sometimes a dentist, steps in while the patient sleeps. It's illegal. It's also, in some clinics, routine. You know this because you have seen it. You did not report it. Reporting means losing your position, your income, and your place in a system that does not reward honesty as much as it rewards output. You told yourself it was temporary, that you would leave before it touched you, but the line between watching and participating is thinner than a suture, and some mornings you are not sure which side you're standing on. You leave. You save enough to open your own clinic, a small one,
2 operating rooms, a consultation office with soft lighting, and a screen where you show patients simulations of what their face could look like. You are careful. You take your time. You build a reputation not on volume, but on results. Word spreads the way it always does in Korea: fast, digital, and merciless. One bad review on a Korean forum can bury a clinic overnight. One viral before and after set can fill your calendar for 6 months. You specialize. Maybe rhinoplasty, maybe facial bone contouring, maybe breast augmentation. The best surgeons in Korea do not stay general. They narrow until they are the best in the country at one thing. A surgeon who spends 90% of his time on noses will see patterns in cartilage that a generalist will never notice. His hands will adjust for asymmetries that don't appear on scans. He will feel the difference between good and right, and that feeling is worth more than any degree on the wall. Years pass, your clinic grows.
You hire associates. You train them the way you were trained, with silence, correction, and patience that looks like indifference but is not. You publish. You lecture. Foreign surgeons fly to Seoul to observe your technique for 3 days, take notes, and fly home. You operate on faces from 30 countries. You learn that beauty is not universal, but the desire to feel seen is. A woman from Shanghai wants a sharper jawline. A man from Dubai wants a softer nose. A college student from Busan wants the same eyes as a K-pop idol you do not recognize. You listen to each of them the same way, not to what they want to look like, but to what they are afraid of looking like. That is where the real consultation happens, in the silence between the request and the reason. You are in your 50s now. Your hands are still steady, but you notice things you did not notice before. A half-second delay in your grip, a slight stiffness in your right wrist after the 3rd surgery of the day. You compensate. You slow down. You take fewer cases. The young surgeons in your clinic are faster than you now. Their stitches are tight, their movements efficient. But sometimes you watch them operate and you see what they cannot see yet. They are cutting correctly. They are not yet cutting with understanding. That takes time. That takes faces that did not go the way you planned. That takes the 3 a.m. calls from patients whose swelling will not go down. That takes the woman who cried in your office because the mirror still did not show her what she hoped it would, and you sitting across from her, knowing that no scalpel could fix what she was actually looking for. You go home. Your apartment in Gangnam is quiet. Your children are grown. Your wife is reading in the other room. You wash your hands the way you always do. Slow, thorough, between every finger, under every nail. You have washed your hands like this 10,000 times. You do not count anymore. Outside your window, the clinic signs glow pink and white against the night sky, stacked 5 stories high, each one promising a new face, a new life, a new beginning. You helped build this world. You also know what it costs. Tomorrow, a 19-year-old will sit in your consultation chair and show you a photograph on her phone. She will point to someone else's face and say she wants to look like that. You will look at the photograph. Then you will look at her. And before you say a single word, you will do what no machine, no simulation, no algorithm can do. You will see her. Not the face she wants, the face she has. In that moment, the one where a surgeon decides what to say and what not to say, what to cut and what to leave alone, is the one that took 30 years to learn. That is the highest level, not the scalpel, the pause before it.